Hello, everyone. This is Dr. Kaveh with special guest Karma Sita here, Karma for short. And we're going to talk about lizard brains, primitive brains, and who has the bigger brain here? Well, obviously, I have a bigger brain, but like, really, who has the bigger brain between Karma and myself? And where do you land in that spectrum? So, first, it wouldn't be complete if I didn't share a story that inspired this today. And this is, not one of my favorite stories because I failed to do the right thing for the patient. And I'll let you be the judge of what you think could have been done differently. But this was maybe 3 months after residency, so really fresh in being an attending. And I had a patient who was incredibly anxious before their surgery. And as I was putting the mask on them, they were like, "How do I breathe, doctor?" And I'm like, "Well, you breathe through your mouth or your nose, however you want, doesn't matter." Because you're supposed to breathe 100% fresh oxygen before you fall asleep with the mask. And that's so that we build up the oxygen in your lungs before you stop breathing, because you stop breathing with that induction dose of anesthesia. And the patient again asked, "How do I breathe, doctor?" "However you want, up to you. Through your nose if you want." "How do I breathe? How do I breathe? How do I breathe?" It was to the point where everyone in the OR was like, "What is wrong with this person?" And I just ended up pushing the propofol. Karma wants the mask too. And the patient went to sleep. Uh, Now, after the patient fell asleep, everyone in the OR was like, "What's wrong with that patient? What was wrong with them?" And my failure was that I didn't speak up for the patient to explain that, you know what, this patient was, they were super anxious guys. They had a history of medical PTSD. They had XYZ other issues. They were understandably anxious. And what happens when your fear gets amplified into anxiety or anger? This is where the lizard brain takes over. So I wish now that I had had the courage and the confidence in myself to put a stop to people ridiculing the patient when they were asleep. I'm not proud about it. But we all learn, especially when you're fresh out of residency, you just are, it's hard to stand up for yourself sometimes, especially in under the stress of how other people are judging you in the operating room setting. So I wish I had had more confidence. I certainly hope that well, I know I do now, but um, for any medical students or residents out there, please remember to always put your ego below that doing the right thing for the patient. So let's get to the primitive brain, because this patient was a perfect example of what happens when the neocortex turns off. Now, you and I, and even Karma here, all have a neocortex. This is in contrast to the primitive brain. The outside of the brain is the cortex. So when you look at pictures of the pink stuff of the brain, you are looking at the cortex. What's underneath the cortex is the most powerful part of your brain. You can't even see it from the outside. It's the most powerful part, but it is the most destructive part of your brain, potentially. Why? Because the primitive brain, the lizard brain, system one has many different names. This is the part that's responsible for your reflexes. So when this patient was freaking out before falling asleep, their system one or their primitive brain was in hyperactive mode. And unfortunately, and this is just the reality. Unfortunately, it's almost, not fully, but almost mutually exclusive between your lizard brain and your cortex. Wow, karma's all over it. Uh, when your lizard brain is fully active in a flight, fight, or freeze response, like this patient was, your neocortex turns off. This patient's neocortex was clearly turned off because they don't exhibit executive functioning, what we would call common sense, because they keep asking me the same question over and over and over again. Obviously, they're not an idiot. Of course not. They're, in fact, just they're what we would call high functioning anxiety. They were like Silicon Valley, actually an executive level type of position that they held. So I'm not giving away any private information. I'm just saying they were very high functioning. But this is the power of that primitive part of the brain. Just so you know, the primitive part, I call it strong because if you want to turn off the primitive part of your brain so it does not overwhelm your cortex, it's next to impossible. In fact, the only ways you can turn off the primitive parts of your brain, and Karma's looking at me here like, can I get more treats, Daddy? The only way you can turn off the primitive parts in Karma or me or you literally are with medications, anesthetics, and yes, the opioid epidemic. Enough fentanyl will cause the parts of your brain that are so primitive that they are responsible for your breathing, will cause them to turn off. You can't really do it. You can't will yourself to overcome your primitive brain, no matter how hard we try. It's incredibly difficult. But the problem is that the primitive brain doesn't end with just breathing and spinal cord reflexes. There's also psychological reflexes that underlie, like we said, the nervous system response of fight, flight, freeze. And just so you know, these are incredibly fast acting reflexes. Like if you touch a hot stove, you immediately withdraw your hand. That's a protective reflex that your primitive brain has completely nailed down. We don't have the same level of reflexes for psychological pain, though. This is one of the main problems that so many of my patients suffer with, and how ketamine, anesthesia, how meditation, CBT can help them overcome. By the way, uh, everyone's comments, I love seeing everyone here. It is Karma, not Carmen, not Cameron, Karma with a K. I am Devil Woman, Pudding Cakes, Pat, good to see everyone on here, Linda, Rebecca. Myasthenia gravis, we can talk about Rebecca at the end, absolutely. I'm sorry that you had that diagnosis. Now, as always, if you could hit the like button while we're having this conversation, I really appreciate it because, as you know, I don't like to run ads or product placement. Your support helps me do this more often so that you can be empowered, like what we're talking about now, to advocate for yourself in the incredibly broken healthcare system that you probably live in if you're in the United States, at least. So back to the lizard brain. What does ketamine have to do? What is CBT meditation? How can this help us reel in the lizard brain in ways that we can, but Karma, as adorable as she is, cannot? Because we have an ability to do more than just live in the reflexive, pain withdrawing state of fight, flight, or freeze. It's a fourth F that nobody talks about. The fourth F is face. Face. To be very clear, we are not limited to fight, flight, or freeze. Unfortunately, there's a heavy amount of victimization that happens. And I'm not gaslighting anyone. I'm not downplaying the real traumas that my patients have. And they are heartbreaking stories. Gosh, you've heard some of them already. And there are just so many heartbreaking stories that come up, and they are legitimate. But we fail to recognize the difference between our brains and the dog's brain and the lizard brain if we don't acknowledge the potential. It's not immediately accessible, but the potential for facing that danger. Now, facing is different than fight, flight, or freeze because it's not suppressing or avoiding the imminent danger. When we are in fight, flight, or freeze mode, we are in some way, shape, or form trying to regain control of the danger. And this is life-saving at the right time. You want your body to be in reflexive action mode. Did you know that when you're under anesthesia, your body responds to the pain of surgery? Your body is trying to do what it can to protect itself, even in the medical coma of anesthesia. In fact, you would die if you didn't have these reflexes. And if you want proof, look at people who are born who cannot feel pain, who don't have that spinal cord reflex that I'm telling you about right now. They die young because they can't feel pain. People need to feel pain and need to be able to respond to pain. They end up getting what? Foot ulcers. I mean, if they're diabetic and they don't feel their feet, from that peripheral neuropathy. That's why we need to do foot checks on diabetics. But people that are born who can't even feel their fingertips at a young age before, even if they don't have diabetes, this will kill people. These are life-saving. Substance P, the neurotransmitter that conducts those pain signals from your fingers to your brain, is needed. Now, if we try to avoid psychological pain, however, we end up suppressing. We end up going into loops of perseveration, rumination. We try to control a situation without facing the situation. Examples. This patient is so desperate to try to gain control of a situation in which case they feel powerless in the operating room, naked on a table. Maybe there's a gown, cold. They don't know what's going on. They don't know the other people in here. Their body's going to be cut open. They're going to go into a coma. Their brain is so perseverated on trying to get control of the situation. They're literally working themselves into a panic attack at the expense of turning off their neocortex to the point where they're asking me the same question over and over again. Intelligent individual, but has literally subverted or hijacked their neocortex because of the mutually exclusive nature of that lizard primitive brain that's trying to spin out of control. You can try to suppress it, but boy, it's just going to fight back with a vengeance. Have you ever tried to not think about something? What happens if you suppress that? It comes right back. We cannot force ourselves. We can't will ourselves. Why? Because these are default settings in our brains. When a baby is born, what does the baby do? It kicks and screams and cries. Our default settings are literally to kick and scream and cry in a reflexive manner. Yes, patients kick and scream and cry all the time, especially when they're coming out of anesthesia. We call that emergence delirium, which is yet another example of that fight, flight, freeze response that's innately hardwired into our body. It's our default settings, like when you buy something at the store. But the difference is that we can reprogram our default response. And if you want proof of this, this is where CBT, meditation, ketamine, these all can demonstrate our potential to overcome that default mode. Once again, the doggy here, as adorable as she is, cannot do that, but you can. It's not easy and it takes a lot of work. But the elegance and beauty is that these self-help techniques, if you will, can do what SSRIs like Prozac and Zoloft and other medications like Wellbutrin, et cetera, cannot do, because they are all band-aids to the fundamental problem of us being a victim to our fight, flight, or freeze response, as opposed to facing it in a mindful, actionary way, as opposed to reactionary. Remember, reactions are how we are innately responding to threats in the environment. It's totally normal. That's how we're born, and it's life-saving in the right scenario. When you're under anesthesia, your body is fighting the anesthesia because it wants to keep breathing. If a painful stimulus is felt, like when the surgeon makes the first cut, your heart rate goes through the roof, your blood pressure goes through the roof. You breathe faster. Your body is doing everything it can under the circumstances to try to escape from that danger, that knife cutting you. When you're out in the savannah and you see something in the bushes shaken, it could be a lion. Your primitive lizard brain is going to take over everything else to try to save you, life-saving, but not when it's chronically turned on. As you know, when it's on 24/7, that's not the same. So how do you reprogram? How do you take what you know in your brain? You know, for example, that these triggers for my anxiety, these triggers for my depression, they're nonsense. You might know that this is not serving me well. This is like maybe from a trauma that I had as a child, from a trauma in adolescence. This trigger is something that's rooted in a bad relationship I had growing up, or some other, you know, uh, heaven forbid, terrible incidents that happened to you. Reality, my patients have had all sorts of horrible things happen. It's not about delegitimizing. It's not about victimizing. It's about recognizing that we need to reprogram our body's response. And how do we do that? How do we do it? It's not with SSRIs. It's not with Wellbutrin. It's not with, the Prozac. methylphenidate, Pristique. These have a time and a place. Of course, I'm not discounting them. They can be life-saving at the right time. But it is an experience from the inside where we can learn to engage in mindful response instead of a reactionary response, mindful actionary response. That's the difference between human being and human doing, right? Human being mindful, so that when that reflexive urge comes, we have a moment to hit the pause button before we lash out, before we're triggered, before we allow something in the external environment to hijack our central nervous system and cause us to say something inappropriate, do something inappropriate towards ourselves or towards those around us. How do we gain that pause? How can we learn to take a quick pause before triggering? That's karma kicking the desk here. How can we take that pause? Karma here can't do that as well. A little bit. I mean, I taught her to do all sorts of tricks. She can be very, very well behaved, but it's very limited, her willpower. We have a little bit more willpower, but our willpower will never, ever overtake our primitive brain. And if you want proof of that, try not eating, try not drinking, try being very bored. Put yourself in the situations where your lizard brain takes over, which, as you know, are being hunger or hangry, bored, tired, frustrated. Eventually, you're not infinite. You don't have infinite willpower. The underlying reprogramming of your response to external stimuli has to be changed. And the layperson way of saying this is that your habits have to be changed. So, as you know, I'm an anesthesiologist and I have a ketamine clinic as well in the San Francisco Bay Area. Ketamine is one of the many ways that allows us to change our self-representation, allows us to better appreciate, gain a different perspective of ourselves in the context of something greater that allows us to begin the path towards reconfiguring our default mode settings that we're born with. Does this make, I really hope that you can all appreciate how we are all subject to the same stresses. Some of us have had more traumatic experiences in the past than others, yet I believe that nearly all of my patients, at least, and probably nearly all human beings, not all, but nearly all human beings have this potential that can be uncovered through persistent changes in self-representation. Ketamine is a powerful way, a safe way, when under appropriate medical supervision, to be able to uncover that potential so that we don't have to be a victim to triggers. We don't have to be a victim to reactions to our environment, whether they cause us to go into internal perseveration and rumination loops that can lead to depression or anxiety, disassociation of PTSD, lead to addictions. Rather, ones that let us take a pause when the stimulus hits us, take a pause to be able to reflect on how we want to act. CBT can also do this. CBT helps us recognize our cognitive distortions and help reprogram them. Meditation similarly can do this. Of course, these take time. Ketamine is powerful because, as you know, wisdom is experience plus knowledge. The experience that a patient gains through a ketamine infusion journey gives them a vast set of experience that they can then practically integrate with the knowledge that they may have read in books all their lives, the knowledge that they cerebrally have. Because we know that we're victims potentially to these thought processes, but it's hard to put our heart behind it to prevent ourselves from falling into these traps. It is the knowledge that we bring into a ketamine experience and the experience that ketamine gives that allows these two to combine together for us to gain wisdom, to ultimately engage in human being rather than human doing. Human doing is reactionary life, anxiety, panic attacks, dissociation. I'm not blaming any patients. No, I'm not blaming patients. These are serious conditions. They can be life-threatening if undertreated, if gaslit, or if overtreated with conventional medications in some cases. So you have this potential to engage in human being and change your default settings, not try to just have more willpower, because you are going to run out just like I'm going to run out, just like how the doggy will run out. Karma can only, look at me for maybe like 20 seconds before she gets distracted. Willpower is limited. Don't think that you need more willpower. That's the example of putting stimulants into the body. You can put stimulants in methylphenidate, for example, what we call Ritalin. You can take stimulants and they'll give you attention. They are burning the candle, though, right? They're literally just hyping up your sympathetic nervous system. This has a cost on the body when used over days, weeks, months, years, decades, etc. That's not the solution to the underlying problem. It's the habits that we have the potential to engage in. So that patient that we started off with, that I told you about, who exhibited this dramatic combination of disassociation, combination of just turning off all of the neocortex, leading to like literally just blabbing nonsense, despite being an intelligent individual. Their anesthesia went relatively okay. They needed a little bit more anesthesia than I would have expected to fall asleep, which is not surprising. We know there's an association with your baseline anxiety and the amount of anesthesia that you need, because your brain, it appears, literally needs more. They woke up a little bit more out of it than I would have expected. Overall, they had a safe recovery. And remarkably, at the end, they actually apologized to me because they remembered asking the same question over and over again. And they woke up feeling a little embarrassed because, like I said, they had the insight. They knew that something was not right within their heart brain axis, as I call it. And I reassured them that it was perfectly okay and there's nothing to be ashamed of, nothing to be embarrassed about. But I sincerely hope that if you or a loved one is having surgery or live with any of these conditions that we've talked about, that you feel empowered to advocate for yourself, to find ways, whether it be with ketamine, whether it be through mindfulness-based stress reduction or CBT, cognitive behavioral therapy, that you feel empowered to take control over your health, because you probably have more power over your health than you've ever been told. It might not be easy, and you can't necessarily do it alone, and it might take a lot of time. And conventional medications do play a role to bridge you to achieving that self-empowerment and that self-efficacy. Using these medications as a bridge to get you there, I think, is very safe and reasonable in the right context. But using them as a destination, meaning that you're going to die taking, for example, the same medication today for the rest of your life, that to me is concerning, because maybe it's not allowing you to figure out what beautiful potential you ultimately have within yourself to heal, to reprogram those default settings. Because if life is not about growth from how we're born from day one, what is it about? I'd love to hear your comments below. And as always, remember that you have more power over your health than you've probably ever been told. And if you learn something new, please share with others. Leaving a comment always helps me do this more often for you. Till next time,